Have you ever caught yourself standing in front of the mirror or noticed during a quiet, private moment that things don't quite feel as robust as they once did? Maybe it wasn't sudden, maybe it crept in slowly, a subtle loss of fullness, a delayed response, a feeling that something you once took for granted now requires more effort or doesn't respond at all. And if you're being honest with yourself, maybe a small voice in the back of your mind has already started whispering something dangerous. This is just aging. This is what happens after 60 point. I guess this part of my life is over. Today, I want you to pause because that belief is not only incomplete, it's often wrong. What if I told you that one of the most powerful tools for restoring blood flow, fullness, and vascular responsiveness has nothing to do with blue pills, injections, or overpriced supplements hiding behind flashy marketing? What if I told you it's already sitting in your kitchen, likely right next to your flour? I'm talking about sodium bicarbonate, plain, simple baking soda. Now, I know exactly what you're thinking. Doctor, how is something I use to bake cookies supposed to help my performance? Stay with me because in today's video, I'm going to walk you through 5 clinically grounded, often overlooked ways bicarbonate can support vascular health and what happens to size, responsiveness, and confidence when blood flow is no longer restricted. If you're in your 60s, 70s, or beyond, and you felt like your edge is slipping, you are not alone, but you are not broken either. In many cases, what you're dealing with isn't permanent loss, it's restricted circulation. Think of it as rust in the pipes, not damage to the system. Before we go any further, take 2 seconds and let me know in the comments where you're watching from. We have men tuning in from all over the world, and seeing that community matters more than you realize. And if you believe men deserve shame-free, evidence-based health information, hit the like button now. It helps this video reach men who are struggling silently. My name is Dr. Rebecca Stone. I'm a board-certified urologist with over a decade of clinical experience, and my work has been dedicated almost entirely to helping men over 50, 60, and 70 protect their prostate health, sexual wellness, and long-term vitality. Everything discussed here is educational, clinically informed, and designed to support, not replace, care from your personal physician. Now let's address a damaging myth head-on. There is a widespread belief that once a man passes 65, his body naturally shrinks, weakens, and shuts down, and that nothing can be done about it. That is not biologically accurate. In many men, what looks like permanent loss is actually vascular restriction. Imagine your arteries as garden hoses. Over decades, inflammation, oxidative stress, and acidity create stiffness like a kink in that hose. When pressure drops, flow decreases. Responsiveness fades, tissues appear smaller, but the hose itself hasn't disappeared. It needs clearing, not replacing. This is why my approach isn't about miracle cures or false promises. It's about optimizing your internal environment so your body, and any prescribed medications can work the way they were designed to. And this is where bicarbonate enters the conversation. Me-5, THE-os Mautek Swake. Your skin is not a solid barrier, it's a semi-permeable membrane. When tissues become congested with metabolic waste and localized acidity, elasticity suffers. Blood vessels beneath the surface struggle to expand freely. By using a localized alkaline soak, you leverage osmotic pressure to gently rebalance tissue pH. When inflammation eases, microvasculature opens, elasticity improves. Blood volume increases naturally. It's like removing a tight rubber band from a sponge. Suddenly, it can absorb again. Method in: 2 tablespoons aluminum-free baking soda, a warm water to soak 10-15 minutes, 3 times per week. Precautions: avoid broken skin or active infections. Rinse thoroughly afterward. I moisturize if skin feels dry. Men often report something unexpected here, not just physical change, but psychological relief. When tissue looks healthier and responds better, confidence begins returning quietly, naturally. As we age, kidney efficiency declines. This contributes to low-grade metabolic acidosis, a condition linked to muscle fatigue and vascular constriction. Acidic blood tightens vessels. Bicarbonate acts as a buffer, nudging internal pH toward balance, signaling smooth muscle tissue to relax. Relaxed vessels mean better volume, better response, less internal resistance. Dosage Lu, teaspoon baking soda, Li 8 ounces water, timing a morning empty stomach. Notes, la salty taste is normal if lemon improves palatability. If you have high blood pressure or are sodium restricted, consult your doctor first. Many men describe this shift as feeling fluid again, like releasing a parking brake they didn't know was engaged. Now that you understand how alkalizing the internal environment helps open the pipes, we need to talk about something just as critical: why so many men are doing the right things and still not seeing results. This is where frustration builds. Because many of you watching this are not careless about your health. You've tried supplements, nitric oxide boosters, beet powders, L-arginine, L-citrulline, even prescription medications, and yet the results feel inconsistent, weak, or short-lived. That's not because those tools don't work. It's because they require the right internal environment to function. And that brings us to method number 3, arguably one of the most overlooked leverage points in male vascular health. Imantade Phe 3, THE, NetDC-ATL, waste East T, nitric oxide, often abbreviated as NENO, is the master signaling molecule for vascular dilation. It tells your blood vessels, relax, open, a low volume. That's why so many therapies revolve around increasing nitric oxide. But here's the truth most men are never told: nitric oxide is fragile. In an acidic, oxidative, inflamed bloodstream, nitric oxide breaks down almost immediately. It's like trying to light a match in a windstorm. You might strike it, but it never stays lit. Bicarbonate doesn't create nitric oxide directly. What it does is protect it. By reducing oxidative stress and buffering acidity, if bicarbonate creates a calmer internal environment where nitric oxide can remain active longer. And that changes everything. Instead of a brief response, followed by rapid fade, you get sustained dilation, more consistent blood volume, a sense of reliability returning. This is the consistency phase. And psychologically, consistency is powerful. When your body starts responding predictably again, you stop second guessing yourself. You stop feeling like you're wasting money. You stop feeling betrayed by your own physiology. You regain trust. How to use this strategically. Take 2 teaspoons bicarbonate in water about 30 minutes before nitric oxide boosting foods or supplements. Think of bicarbonate as the stage crew that prepares the environment so the main performance can actually happen. This is not about chasing extremes. It's about maintaining a steady state of readiness. Manage Vedi2, riboside, idoflamin to ion. There's a medical term you may not have heard before, but it explains a lot of what men experience after 60. It's called inflammaging, chronic low-level inflammation that slowly builds over decades. This kind of inflammation doesn't cause sharp pain. It doesn't send you to the emergency room. Instead, it quietly changes tissue structure. Over time, inflammation leads to fibrosis, the buildup of stiff, non-elastic tissue, and here's why that matters deeply. Even with perfect blood flow, fibrotic tissue cannot expand properly. It's like trying to inflate a balloon made of cardboard instead of latex. No amount of pressure will restore flexibility unless the tissue itself becomes healthier. Bicarbonate has been shown to lower inflammatory markers such as C-reactive protein, helping reduce this slow, destructive process. When inflammation decreases, tissue elasticity improves, expansion capacity returns, comfort increases. This isn't just about function, this is about dignity. Realizing that your body can remain healthy, responsive, and intact well into your 70s and 80s is incredibly empowering. It reminds you that aging is something you can participate in, not something that just happens to you. How to apply this safely. Follow a pulsed approach. 1 teaspoon bicarbonate daily, 5 days on, 2 days off. This prevents dependency and allows your body to maintain its own buffering systems. IMPR TANT PSYCLOJL NOUT. One of the most underestimated aspects of men's health is anticipatory anxiety. When your body has let you down repeatedly, your brain starts expecting failure. That expectation alone can restrict blood flow by improving internal chemistry and tissue health. Many men report not just physical change, but a reduction in performance anxiety. Your body stops feeling like an opponent. It starts feeling like an ally again. Amiacho Phi 1, Th Gugon Ratio. This is the most powerful, balanced, and practical way to use bicarbonate. It combines bicarbonate, potassium citrate. Together, these three create a synergistic effect. Potassium balances sodium. Preventing unwanted water retention. Citrate further alkalizes urine and blood. Bicarbonate buffers acidity. The result: a gentle system flush. Think of it like clearing static from a radio signal. Suddenly, communication between your brain and blood vessels becomes clearer. This is why men often report improved morning responsiveness when they use this consistently. Recipe: we 8 ounces filtered water, 1 teaspoon baking soda, bay juice of half to 1 fresh lemon. Routine: a drink 20 minutes before breakfast. Why before coffee? Why before supplements? Safety note: men with chronic kidney disease must not use this without direct medical supervision. Abu hyt marnangeritual mati ars. Starting your day this way does something beyond chemistry. It sends a signal to your nervous systems. My vitality matters. That mindset shift often leads to better food choices, more movement, better sleep, better self-respect, and those changes compound. Health becomes a virtuous cycle, not a battle. Now that you understand why bicarbonate works, how it supports vascular health, if and where it fits into a larger physiological picture, it's time to turn this information into something practical. Because knowledge without application only creates frustration. I don't want you walking away from this video thinking, that made sense, but I still don't know what to do tomorrow morning. So let's build a plan, a realistic one. Not something extreme, not something expensive, not something that takes over your life. Just a clear, structured approach you can actually follow. TH30 to AY2LYRSE. This is the same phased approach I recommend in my clinical practice because it respects how the body adapts. PSA1 DAS 114. Clear the rust. Your focus here is internal chemistry. Every morning, either teaspoon baking soda, we 8 ounces water, a squeeze of fresh lemon. Drink 20 minutes before coffee or breakfast. That's it. No stacks, no overload, no chasing sensations. Think of these first 2 weeks as clearing the pipes. During this phase, some men notice improved digestion, less morning stiffness, slight warmth or heaviness in the pelvic region. Those are positive signs of improved microcirculation. PACE2 daywise 1530, improve elasticity and flow. Now we gently layer in the external component. Continue the morning tonic. Add osmotic soak 2 times per week by 10-15 minutes. A warm water plus baking soda. This phase focuses on tissue responsiveness, not just blood delivery. You're allowing the internal changes to translate into structural improvements. EFA or THE bar minimum GUIS, let me be honest. Some of you watching are thinking, Doctor, I just want the simplest thing that gives me the biggest return. That's fair. If you do nothing else, stick with the morning drink. That internal pH shift is the most powerful lever for vascular health. Everything else is additive, helpful, but not required. Let's be very clear, you are not going to wake up tomorrow with the physiology of a 22-year-old. That expectation only leads to disappointment. This is medical science, not a magic trick. What most men report instead within 2 to 4 weeks is the increased warmth, a feeling of fullness returning, the improved morning responsiveness, a more consistent performance, reduced anxiety around function. Those changes are gradual, sustainable, and cumulative, and that's exactly what we want. We're not chasing fantasy. We're protecting function, confidence, and dignity. THE by GRP Shituur, why this actually matters. If what you're really doing here isn't just improving circulation, you're sending your body a signal. I'm still paying attention. I'm still invested. I'm not giving up on myself. I see men in their 70s and 80s every single week who maintain remarkable health, not because they're lucky, but because they respect the small details. Internal pH inflammation control, vascular health, consistency, these things compound ORD-ABUSHME. Too many men suffer quietly because they believe this topic is embarrassing. It's not. It's biology. And ignoring it doesn't make it go away. It just steals years of quality from your life. You are not weak for caring about your vitality. You are responsible. INL, a CTO, and step S. 1, drop a comment below. Which step are you starting with? The morning tonic, osmotic soak, or both. 2, hit the like button. It helps this video reach men who are struggling silently. 3, subscribe. I post new evidence-based strategies every week specifically for men over 50 who want to stay strong, functional, and confident. 4, share this video. Send it to one friend who might need it but won't ask. Let's break the silence together. Gentlemen, aging does not mean surrender. What you've experienced is a